So now it's my job to introduce our special guest today. I think also Sara has, I could go on a long time about what Sara has done, but I think I tend to find that with all people who, like the Minister, who want to do rather than just talk about it, I keep it brief and say it can be argued, and the Minister mightn't always love this, I suppose, that Sara has become one of the most prominent and outspoken analysts of our health system and our changes and so on in recent years. I do look forward to listening to her on drive time. I'm not sure the ministers do every week, but I do look forward to listening to her on drive time as I'm normally in the car going home, and Mary Wilson says, and now we're going to our health piece with Sara Burke, and I say, go on, Sara, yeah, keep going, and so on and so forth. But listen, it is my pleasure to introduce to the meeting Sara Burke to speak to us. Thank you very much.
Good morning, or I think maybe it's afternoon at this stage. Thanks, Liam, and good morning, Francis. It's an honour, and all of you. I always say when I speak to nurses, I get most nervous coming to talk to nurses because I feel there's no fooling you. You know it. You know the system better than anyone else. So I always feel more anxious. I was perhaps equally anxious this time last week because I was talking to the Fianna Fáil conference, and it was their first ever policy conference. Can you believe that? So I had the honour of addressing them. And actually Billy Gallagher said to me before he was introducing me, how often are you on the radio? And I was going, oh, just once a week. He was like, only once a week? Jesus, when you're in government, it feels like you're on every day. So I thought that was a good compliment in a funny way. So what I've been asked to do this morning, and I'll try and do it, I think I was asked to do it in 30 minutes, but I'll try and do it a bit quicker than that, is detail the main aspects. So to place the Child and Family Support Agency in the context of overall health policy reform, and to critique progress to date, and then to situate where the Child and Family Support Agency fits in with that overall health reform, and the challenges ahead for that agency, but also for you as community nurses and public health nurses. And I struggled with whether I should just do sort of the second half of this, because that's what you're here today to discuss, and that's why the Minister is here. And yet I think it's important to situate this agency within the context of broader health service reform. Just some water. The programme for government, I think, in the health area is historic because it does commit to a universal single-tiered system for the first time in the history of the state. And it plans to do this through various mechanisms, but a key mechanism is through universal health insurance. And these are just quotes, I'm not going to read them out for you, that are in the programme for government. But I find it useful to go back and reread what this government has committed to do in the area of health. It's also promised a key plank of getting there is free GP care by 2015. And then it makes arrangements. I have the pages over there. There's 7 or 8 pages in health, and I've just picked out key ones, although you could say selectively, but I think they're important ones. One is about driving down the cost of the delivery of care, so it's more affordable to provide more care to more people. The establishment of a special delivery unit. The Minister for Health taking more responsibility and control, I think, over health policy, and also particularly around cost control, around the HSE ceasing to exist over time and the functions returning to the Minister. Money follows the patients. You'll have heard these all the time from James Riley. Hospitals to become independent trusts. Investment, and actually I only reread this last week, investment in more and better care for older people, and it talks about more home help, more home care packages, about bringing down the price of drugs, about capital, so buildings being a priority, about a new GP and consultants contract and reducing their pay. So there's really huge, huge commitments for health within the programme for government. In sort of social care area, there's a range of very positive commitments in the area of mental health, including 35 million for community mental health teams to make those services more accessible to both children and adults within the community. Universal primary care on a phased basis, and in particular earmarked for this year was 17 million for free GP care for people on the long-term illness scheme. And then in the area of children, and I went back to that as well, and really the key areas is about setting up this new child, it had a slightly different name then, but now it's the Child and Family Support Agency, about putting children first on a statutory footing, and about amending the Constitution for children's rights. And I think, and I'm not just saying it because I've known Frances Fitzgerald for years, because I'm very happy to be very critical of any minister, but I think in Frances Fitzgerald we have a different type of minister. We have a woman who knows her stuff in this area, is really committed to it, and is providing leadership and driving change. And I think we saw that around the Constitution. We've seen it around beginning to put children first on a statutory footing, and also in relation to the Child and Family Support Agency. And I think that having a good minister is a really important part of getting the other stuff right. And I would be much more critical of many of her colleagues. In terms of progress to date, the key plank is this universal health insurance, and there's an implementation group sort of working behind doors trying to work out how to get the model really that James Riley wants, which is about competing private providers. They published, James Riley, Alex White and Kathleen Lynch published a document called Future Health, which was meant to be this roadmap of how we get from the health system we have to the one they plan, and that was published last week. And I don't think it's a roadmap at all. I think it's very vague. There's very little new information in it, and if anything, it's just taking a step back on previous commitments already made. What's good about it, I think I've said already, I think it is really significant that they want to introduce a one-tiered system where access is based on need and not ability to pay. And we have to keep on supporting them or harassing them into delivering on that. Likewise, the plans for free GP care. There have been some progress in the area of waiting times, both in terms of emergency departments and also length of time for patients to have elective care in hospitals. They're not good enough, but I think you have to give the special delivery unit some credit on that. However, I actually think that the progress in waiting times is actually being delivered by the clinical care programmes that have been in place since 2008, 2009, and we're really beginning to see the benefits of them now. And I do think the fact that we have a full cabinet minister with responsibility for children and this new Child and Family Support Agency is one of the most positive developments within broader health and social care reform that's going on. And actually, I was reading the task force report yesterday, and I have to read endless reports about health, and most of them are bloody awful. And it was a privilege to read the task force report. It's clear, it's well written. If you haven't read it, it's not that long. I'd really encourage you to read it. There's an appendix on the role of nurses and community nurse, but also there's little nuggets in it. I spend my life trying to find out what proportion of child and adolescent mental health teams are actually functioning, and it has that figure in it. So it got really good information that isn't necessarily in the public domain. And the other thought I had about it was, when I was reading it, was someone should lock James Riley into a room with it and make him read it. Because actually what it is doing is doing the direct opposite to what he's doing in health. He's dismantling the governance structures, he's putting a new structure without any detail on how that will actually work. And what the task force report is doing is the exact opposite. It's like, this is international best practice, this is good governance, this is how this should work. Can I get a chair up here, just because I'm a bit too tall tonight? Reading easier. I was talking at a conference in Europe during the summer wearing platforms, and I took them off and did the rest of the second half in barefoot, and the men nearly died. But anyway, I'm a bit too tall. That's much better. Okay. I'm not going to go into too much detail on this, and in fact, much of it is what I prepared for talking to Fianna Fáil last week, and I've blogged on it. So if you're interested in it, the content is up on my SaraBurke.com. And while I'm very critical of current government, don't worry, Frances, I was also very critical of the previous 14 years that they got us into the mess, so I didn't leave them off the hook. And I just took a few of the key areas. And I will race through them quickly because I think some of them have real implications for the work of nurses and PHNs, but also the new Child and Family Support Agency. And I guess my sort of modus operandi is to judge government or people in positions of power on what they say and whether they deliver or not. And I think I've given credit to Frances Fitzgerald that you are delivering so far on the commitments made. But I think that's less evident in other aspects of the health service. I think the failure to deliver on progress around free GP care is a good straw poll of what the government hasn't done. We know from Roche and Shortall 300 extra staff were signed off on. They were press released on the 17th of July, the same day as the primary care list came out, so that there was meant to be 300 extra staff, and this is part of about providing free GP care to the whole population. And at the press briefing on Future Health 2 weeks ago, the Minister confirmed that that 20 million was used to shore up and pay for additional medical cards. They haven't delivered on free GP care for the 70,000 people they said they would by last March to people on long-term illness schemes. Everyone knows somebody on that scheme, and having free access to a GP does deter them going to a GP, because not everybody has that 50 quid in their pocket. And I think it's unlikely, although Alex White has said that they are going to legislate for it, but I think it's unlikely that the next scheme, which was people on the high-tech drug scheme, that will be delivered by next March. And I find the primary care centres debacle particularly worrying of the form of the current government, that it's okay that political interference can determine the location of primary care centres. A big part of the Minister's plan was that we need a lower cost base for our health system so we can provide more care to more people. And I think they have failed. A big part of that is about transferring care from the hospital to the community. But if you don't support and build up those services in the community, then that's just not going to happen. And counterintuitively to the government policy, they've failed to deliver those primary care staff. Instead of, the programme for government says more home care packages, more home help, and this year there's basically 1 million fewer hours for home help. That ends up costing, and actually John Lonergan has a very powerful piece in this morning's Irish Times making this point, and it's great to hear other voices making that point. There's been no negotiation or cutting of pay of GPs and consultants, and I think it's hard for others to go, like new junior doctors having their pay cut by 40% when they see their seniors not being touched. I think a big part of the reason the HSE is in the financial trouble it's in is that Minister Riley didn't deliver on his commitments around charging for private beds in public hospitals and also driving down the costs of drugs. And the new deal done with the pharmaceutical companies that was heralded as a great success story, in fact, it says it'll save 400 million over 4 years. Actually, when you look at the cost of what hasn't been saved so far this year, but also the cost of new drugs, which is included in the deal, much to the delight of the pharmaceutical companies, it actually only saves 96 million over 4 years, not 400 million. And we pay the highest in the OECD country for drugs. In terms of abolishing the HSE, you could say the Minister has been spectacularly successful in this, in that the board stood down pretty quickly. He got rid of the CEO. There's 9,000 fewer staff. That was part of the redundancy programmes in there. But I think what he's done is the opposite to what the Child and Family Support Agency has done. Is he's dismantled the governance structure. There's no governance structure. There's just a makey-uppy board of people from the HSE and the Department of Health. And then he's introducing these new directorates. But he's only introducing these new directorates for 2 years, for 2013 and 2014. And then what happens to these new directorates? And I ask the Minister at every briefing I go to, tell me how this is going to work. If money follows the patient and I leave hospital and I need mental health and social care in the community, how does that money follow me? And he's never managed to explain it. And I think the absence of clarity on what happens to the HSE after 2015 is a big issue and a real problem for the current government, although they don't seem to think so. There has been progress, and I won't go into detail this, but just to give credit where credit's due, there are fewer people on trolleys. There are fewer people waiting for elective care. They have collected for the first time the numbers of people waiting for outpatient appointments, and there's over 385,000 people waiting for that first appointment. And as I pointed out to Fianna Fáil, that was a damning indictment of their policies, not rather than the current government, because they caused that. But with nearly 50,000 people waiting over 2 years for that first appointment, 11,000 people waiting over 4 years, like still really shocking figures. But the fact that they have them and they're willing to publish them and begin to do something with them, I think is very positive. And I think the silent success story of our hospital care anyway in the last few years is the clinical care programmes, and I think that's where we're beginning to see why there's progress in that area. I think, worryingly so, and I've said this in lots of fora, James Riley has sort of had this purge of everyone around him except people who agree with him, and he has a new Secretary General in the Department of Health, which was a political appointment, a new HSE Director Designate, or whatever he's called, CEO Designate, who was handpicked without any public competition. Roisin Shortall left on obviously a falling out on a point of principle. And I think what he's doing is he's bringing the power and the purse back into the department without real clarity on that. But also I think the primary care centre selection is evidence of the danger of bringing politics back. One can be very critical of the HSE, but what the HSE did was it took that local politics out of health, so that decisions are meant to be based on clinical need, not evidence. And I think James Riley is undoing that and re-putting himself in that central decision making. And I've asked questions about how will the makeup of the hospital groups be decided, because the report is going to government in the next, around now actually, it was meant to be in November, and the response from the Department of Health press office was that the government will decide the makeup of hospital groups. And I really feel that's bringing us back decades rather than forward. Okay, so this is the second bit, slightly prettier picture of where the child and family support agencies fits in with health reform. And having worked in the 90s in Focus Point with homeless teenagers and spent my days ringing up what were at the time health board social workers trying to find places to stay, or social workers for those teenagers, many of whom are now dead, I think there absolutely needs to be this separate child and family support agency. I think it's very positive that already it has a vote or a budget of its own. It started that last year, that it has a minister of its own, that it's done significant work. A pretty small government department has done an awful lot of work and managed to, now I know there's differences of opinion on this, but I think managed to actually increase, say, the child protection, child care staff rather than decrease, which is an achievement in the current environment. The task force report, I think, is very strong, and they do have this sort of transition phase with a lot of time and energy and planning going into it. And there's really, the Centre for Effective Services did some of the background work, or my sister works, so that would declare an interest, did some background work around the international best practice of early intervention and child and family support. And what they found from other countries was that community and public health nurses play a really key role if you want to do that early intervention work rather than that constant, the milkman or milkwomen analogy rather than the fire brigade, because you're the people who are in and out of those houses 5 times early in life, and you are the best sort of early warning system. You know those children and their families, and that's what the international evidence says, that your profession can have a key role in that, and that's why they recommended you go in at phase 1, although that's not now happening. So I think it's really positive that there is a focus on this prevention and early intervention. I think to keep its momentum, it needs to happen soon, Minister, and I know you said in the new year, but it's not going to be 1st of January up and running. I presume it'll take, and I presume, even yesterday just reading the report, it must be very complicated legislation to transfer those powers from the Department of Health to a new, or from the HSE to a new agency. So I don't underestimate the complexity of it, but I think to maintain the momentum, it needs to begin to happen soon. And I think the budget is a key issue of how much your department or that agency will get, and does it, I think it was Fergus Finlay last year made a big issue about whether it was carrying over a deficit or not, and is it sufficient, and the figure he and others have put out there is about 600,000, so we'll see next week, Minister, how you got on that one, or this afternoon. And I think there's a big issue about getting the structure right. And that's, of course, about good governance and management, but also about that interdisciplinary stuff. And Liam was saying, it's not easy. It's not easy, Liam, but God, we've got to do it better than what we're doing it at the moment, because we're just not doing it at the moment. And I think what the task force report outlines is just how key that is. And it's not just between professions, it's also between those professions and the families and the professions and the community. And the other thing I was thinking yesterday with reading the report is the stakes are so bloody high on this, that we have failed children so consistently that you have to get this one right. It's not, it's an enormous task. And in a way, we can't fail on this one, because we failed so consistently, children at risk, that we really have to get it right. Another thought I had reading it was just how independent are you or the new agency going to be? So, for example, if there are cuts made to child benefit that disproportionately affect low-income families who are more likely to have children at risk, can Francis Fitzgerald or the Child and Family Support Agency be kicking government's ass going, you can't be doing that for the children most at risk? And obviously that'll take a few years to pan out, but I'm hoping already you're doing good backroom work on issues like that. I think the focus on universality within the task force report and the new agency is really, really strong and important. And yet, if you look at the Troika reports, I went through them this week for another piece of work about what they're saying about health and social care. They're saying the complete opposite to what the task force report is there. So there's a tension there for government that if they're trying to have this universal service, and what the Troika is saying is a targeted means test, targeted means test. And I think the failure to deliver on other reforms, like in primary care, the point I've already made, are the deficiencies in the rest of the system, that there aren't fully staffed child and adolescent mental health teams, makes it much more difficult for the Child and Family Support Agency to do its job, because it's dependent on other bits of the system working, and if they aren't fully functioning, then it's nearly mission impossible to do that. I guess the absence of flexibility on budget, I'd love to know how much of the 600,000 is on pay. And of course, pay and people are central to this service. But there's very little to cut, I presume, for you, Minister. So how you manage to do all this and do it differently. And then also, I've been studying recently with Charles Normand in Trinity, who's renowned for telling the same stories again and again. God, I shouldn't be saying this on camera. But one of his stories is that when there's significant reform, like say there was in the HSE, or there is now going to be in the Child and Family Support Agency, it nearly takes 5 years just to get to the starting line again, because you throw everything up in the air. So in a way, I think we have to be patient with the new agency, because there's going to be a lot of change, and it does take years to embed that and to particularly to change practice. I think there's a big issue about what goes in and what doesn't. And having read the report, I'm really disappointed. You mightn't be, but I'm really disappointed that community and public health nurses aren't in there now, and that child and adolescent mental health teams aren't in there now. Because I think the whole rationale of the report is that you're not the firefighters, you're not the child protection, acute child welfare, you're doing the day in, day out bread and butter stuff. And so not having them in there at the beginning, I think, not having you in there at the beginning is a problem. I know there are difficulties with dividing up public health nurses, because you currently work with older people and people with disabilities and children. But again, the international evidence shows that it is possible to do it. And even though you might like that mix of work, actually you tend to be more effective if you're focused on one area. And there's examples in that CES report about skills and training, and that's a big part of the new agency as well, about building up the skills and capacity within the workforce. So if you are going to be those child and family public health community nurses, then you need additional training and ongoing skills learning about how to really support those families at an early stage. And if you stay in the HSE, even though we don't know where it's going or what its structure will be or what will happen it, there are inevitably, because of our demographics, going to be increasing pressures to do that care for older people, to do this chronic disease management through the clinical care programmes. And I think that the child and family support bit, you'll get less of that unless you're sort of ring-fenced and safe in the new agency. I've made this point already, that what the Child and Family Agency is doing is virtually the opposite to what James Riley is doing to the HSE. And I was thinking we're in we're in a state of known unknowns about the future of the HSE. In terms of your role, I've said this already, I think you could be a real asset to this agency, and what you hear and see is invaluable. And I think there's a real, like if I was community public health nurse with a real interest in working with children and families, I'd be thinking, I'd really like to be in there because at least we know where it's going, it's got a roadmap and it's got a decent minister and it's got a budget, and we don't know what's happening in the rest of the system. And I think there is a real chance for multidisciplinary work and early intervention and prevention. And again, the point I made earlier, like I think the child deaths exposed to us, just the gaps within the system, that we didn't know how many children had died within the care of the state, and it took a full investigation report to reveal there was 200. But we don't know how many of those other children who don't die that we are currently failing. And I think the opportunity for this agency is to meet the needs of those children and to stop us making our really awful mistakes of the past. And yet, if you're not in this new agency, and you're not at the moment, but maybe you're better off in phase 2. A couple of people I spoke to yesterday said, maybe the community and adolescent mental health teams and public health nurses will come in phase 2 because you are so key to it. And maybe let them make all the mistakes in phase 1 with the other staff and then bring you in. You know, there might be a wisdom to that in a year or two, particularly given that we don't know what else happens, the HSE post 2015. But I think there is need for clarity on your roles as nurses and PHNs within this agency, and also that adequate staffing is key. You know, that you're not watered down by being brought into it. And I guess finally, and that's a point I've made already, I think if I were you, I'd be wanting to get into the Child and Family Support Agency rather than staying here. I think there's real opportunities. And like I said before, I think the stakes are too big to fail on this. And I wish you well, and I wish the Minister well, and I really hope it works. Okay, thank you very much.